It is that time of year again when people, some, give up alcohol for a month, others rush to a gym determined to get in shape or jump on a viral diet they may have seen on social media. For more on how to set a health goal and stick to it, bear that in mind, is our CBC health columnist, Dr. Melissa Lim. Happy New Year to you. Nice to see you.
Likewise.
So what do you think of these health-related New Year's resolutions? And some people get very enthusiastic.
Well, I think now is the best time to make a resolution to change your health. And what better time to make that kind of resolution than early on in the new year? And one of the reasons is because better health improves our happiness. So we know that about 40% of our happiness comes from our lifestyle choices and also our activities. And people who report that they are healthy are about 20% happier on average than other people. But unfortunately, there is a dark side to those New Year's resolutions. It kind of plays into this idea that we are not enough and that we need to completely reinvent ourselves every year. And unfortunately, over 90% of people don't keep their New Year's resolution. So this can really set us up for disappointment and low mood.
Well, and when people are going from a place of perhaps celebrating a bit and indulging, and they decide, okay, this is the year I'm finally going to get in shape, and they decide to go to the gym, sometimes they don't set those realistic goals. If they say 5 days a week, I'm going to do it, and then by February, they're done. What's a better way to realistically set realistic goals?
Well, for some people, that kind of massive overhaul works. I do have some patients who, for example, say, I'm going to change everything about my life. They manage to do it in a short period of time and have better health for the long term. But these are unicorn patients. The vast majority of us do not work that way when we make a change. And this is actually something that's become more popular and something, in fact, my 10-year-old who's in grade 5 learned to do last year. And they're called SMART goals. So the S stands for example, if you want to exercise more, make it specific. So say I'm going to, after work, Monday, Wednesday, Friday, go to the gym for 30 minutes each time. Make it measurable is the M. So clock those minutes, clock those days that you go to the gym. A is for achievable. You want to make sure this is something that you can do, not saying I'm going to run a marathon next month when you rarely run. That sets you up for a possible injury. R is relevant, so know why you want to make that goal and make sure your plan is going to get you there. And then T is time bound, so making sure that you have time parameters around it and sometimes even circling a date on the calendar where you say, okay, by this date, I'll have achieved this goal.
And quickly, what about the mental health benefits of setting realistic goals?
This can really help because, again, it allows us to achieve a goal that gives us this sense of mastery. And really, one of the goals I think that we should be thinking about, and something a lot of people are thinking about right now, is dry January. You know, as you mentioned, we want to make sure that we're having a healthy diet, exercise, and sleep, but limiting our alcohol intake really does reduce our risk of cancer. And it's something that the U.S. Surgeon General has really been talking about lately, is labeling alcohol as a carcinogen to make sure that people make healthy choices in the new year.
Dr. Melissa Lim, we appreciate your time and your expertise as always. Thanks for joining us.
Thanks, Dan.